Sign number 1. You're always full. Did you know that gastrointestinal or digestive symptoms can be a sign of heart failure? I know, that probably sounds kind of counterintuitive. I mean, how could stomach problems indicate that you have heart problems? Aren't they separate systems in your body? Yes, but these systems are actually intricately connected. Let me explain. Your heart's job is to pump oxygen and nutrient-rich blood throughout your body. This blood is crucial in that it allows your organs to function properly.
You can get nausea even. Yes, nausea and vomiting can be symptoms of congestive heart failure. You can get a decreased appetite or early satiety, meaning you get full.
As Dr. Frieda says, nausea, vomiting, and a decreased appetite and feeling full quickly can be signs of heart failure. And according to the Mayo Clinic, bloating and heartburn are also associated with heart failure. Now, it's important to mention these symptoms don't mean you absolutely have heart problems. They could instead indicate that you have some sort of digestive disorder, but it's worth a trip to your doctor either way. Sign number 2, erectile dysfunction. I know, you understand the connection between the heart and the digestive tract now. But this? Hear me out. Remember how I said the heart is responsible for pumping blood throughout the body, so if it's not functioning optimally, other systems in your body may fail? The same goes for erectile dysfunction. Said another way, for normal sexual functioning, nutrient and oxygen-rich blood flow is required, and that blood, of course, comes from your heart. Still aren't convinced? Listen to this. A study published in the journal Circulation found that about 60 to 87% of patients who suffered from heart failure also reported sexual problems along with it. And when it comes specifically to erectile dysfunction, another study, this time published in the journal American College of Cardiology, found some rather shocking results. What they discovered is that the occurrence of erectile dysfunction, or ED for short, has been reported in nearly 81% of cardiac patients. When you compare that with the occurrence of ED in the older population, which is only about 50%, it's a pretty significant difference. Urologist Dr. David, paying attention to ED is particularly important because, and this bears repeating, it can be one of the first signs of heart disease. Okay, so what if you're a woman? Are you exempt from this issue? Not exactly. Heart-related sexual dysfunction doesn't just affect men. A recent study, for instance, actually found that 25 to 76% of women with heart failure also suffered from sexual problems. Sign number 3, ankle swelling. Another bizarre sign of heart failure that you might not be aware of is swelling, especially in your ankles, feet, or legs. No, I'm not talking about swelling after you sprain your ankle or stub your toe. I'm talking about swelling that has seemingly no explanation. But as you may have already guessed, there can in fact be a sneaky explanation for this swelling, and that's heart failure. The reason for this, again, goes back to your heart's role in powering full-body blood circulation. In this case, the problem happens when your heart isn't providing enough blood flow to your kidneys. That's because excessive swelling, known as edema in the medical community, can be caused by issues with your kidneys. Your kidneys are responsible for removing extra fluid from your body. So while a properly functioning kidney is able to remove excess fluid, a kidney having a little bit of trouble might cause you to develop edema or swelling, especially in areas like your ankles. All this to say is that a possible reason for swelling is a lack of blood flow caused by, you guessed it, heart failure. Cardiologist Dr. Nadiri goes deeper into some of the signs of ankle swelling you should look out for, particularly the timing of when it strikes. Let's listen to what he has to say.
I often hear patients report that the swelling is worse as the day progresses.
Just because ankle swelling has decreased or even disappeared by the end of the day doesn't mean that you should ignore it. In fact, any ankle swelling at all should be investigated by you and your doctor. Sign number 4, cough. Not all coughs are created equally. In fact, did you know that the type of cough you have can indicate different health conditions? That's right, your cough is actually sending you a secret message as to what ailment you might be suffering from. A wet or mucousy cough, for instance, can be a sign of the cold or the flu. A wheezing cough can be a sign of asthma or bronchitis. And a cough that produces white or pink mucus can indicate heart failure. But wait, you might say, how can a cough that's driven by the lungs indicate heart failure? Oh. Yep, you're beginning to see the pattern here now, aren't you? The heart and the lungs, like every other organ we've talked about, are intricately related. Here's a quick biology lesson to help you understand this. Yes, it'll be quick, I promise. Your heart and lungs work in sync to deliver oxygen-rich blood throughout your body. First, your heart sends blood to your lungs, which fills it with oxygen. This blood is sent back to your heart, which then pumps it to your body's tissues and organs. Because your heart and lungs are a team, if there's a problem with one, you're going to see an effect in the other. When your heart isn't working properly, for instance, it can't process the oxygen-rich blood delivery from your lungs fast enough. This leads to a backup of blood in the vessels between your heart and lungs, and can eventually cause fluid leakage into the lungs. That's what causes the mucousy, blood-tinged cough. There's even a name for this type of cough: cardiac cough. Cardiologist Dr. Mitri explains more of the biology of what happens when there's this backlog of blood.
The lungs get congested with the blood, and water from inside the blood, because blood is mainly water, the water seeps out into the lung tissue. And when that happens, people start getting breathless, and then the cough mechanism is activated just to try and clear the airways. And that's how you get what we call a cardiac cough.
If you're still having trouble picturing this, here's a metaphor for you. Think of your heart like a mailman and your lungs like the post office that stores all the mail, or the blood in this example. One day the mailman comes down with a cold, and he's working a little slower than usual. But the package, or the blood, keep coming, and he can't keep up with the deliveries. So they accumulate at the post office, your lungs, and just because you have a cough does not necessarily mean that you have heart failure. But that being said, it's always a good idea to talk to your doctor. Sign number 5, weight gain. Are you a total health nut, running 5 miles a day, putting in hours at the gym, eating only chicken breast, kale, and sweet potatoes? And yet somehow you seem to have gained weight. And I'm not talking about muscle weight, the good kind of weight. You've probably heard that being overweight can increase your risk of heart problems. You may not know that the reverse is true as well. That's right, another one of the surprising indicators of heart failure can be weight gain. The reason for this goes back to our old friends, the kidneys. Remember when I told you that heart failure can restrict blood flow to the kidneys, and that this in turn can cause edema or swelling? Well, what happens when you have excess fluid in your body? You gain weight. So if you've noticed that the number on the scale has gone up in a short amount of time, this is likely due to fluid retention and potentially heart failure. This is especially the case if you've noticed that you have swelling in your stomach or ankles. And these are some of the most common places that edema occurs with heart failure.